Katia Guardano, and I will be your nurse today. I have already washed my hands. I'll be doing your head to toe assessment, and this will take about 15 to 20 minutes. I have already taken his vitals, and his vitals are, his temperature is 96.8, his pulse 672, his respirations are 12, his blood pressure is 120/80, and his pulse ox is 100. Are you in any pain today?
No.
And his pain is 0. So what is your name?
Asiel Guardado.
What's your date of birth?
7/5/96.
And where are we?
The clinic.
So my patient is alert and oriented to times 3 to person, place, and situation, and his mood is good. I woke him up earlier and he was just fine. So now I will move on and inspect his skin. His skin is good. It is warm, and there are no lesions. He does not have any tattoos. It's non-tender. Now we'll inspect his nails. Let me see your hand. His nails are trimmed. They are, there's no signs of clubbing. His cap refill is less than 3 bilaterally, and I will also check his toes, and his toes are also less than 3 equally bilaterally. Next, I will inspect his skull. His skull is normal cephalic. His scalp is white and dry with no parasites. His hair is evenly distributed. It's black, thick, and now I will inspect his face. So all his facial features are symmetrical. His eyes are in the upper third of his body. His nose is midline, and his mouth is in the lower third of his body. His mouth, his face. His mouth is in the lower third of his face. Now I will check for his neck. His neck is symmetrical. I will listen with the bell of my stethoscope. And I am just, I listened for any bruise, and his pulse is strong and equally bilaterally. So now I will inspect his eyes. His eyes are white, or his sclera is white. His conjunctiva is pink and moist. And now I will dim the lights. His pupils are equally round and reactive to light. I would say they're about 3 millimeters. Now let me Next, I will assess his ears. His ears are even and symmetrical. There are no foreign objects in his ears. He has a small amount of cerumen, and they are not tender. Next, I will inspect his nose, making sure there's no drainage. His septum is not deviated. And next, I will inspect his sinuses, his frontal does not have any cracking of his lips. They're smooth. His tongue is nice, pink, and moist. His teeth are all intact. The upper, you lift your tongue up, sorry. And you can see the veins on his tongue. The ventral surface is smooth, and it's glistening with veins. Now I will inspect his tonsils. So his tonsils are a size 2, and 0 would be that they have been taken out. 1 would be that you can barely see them. 2 is normal, which is what his were. 3, they're big, and 4, they're like really big. So now I will inspect and palpate the anterior and posterior thorax, and I will check his skin turgor, and the way I would do that would be right there. It's normal. His spine is midline, and are you having any pain?
No.
It's non-tender, no pain, and his chest is symmetrical and it expands good while he's breathing. So now I will listen in the 10 areas using the side-to-side technique. So I want you to breathe through your mouth just a little bit more deeper than you normally would. Okay, can you turn that way for me just a little bit? Okay, his breath sounds are present, and there are no adventitious breath sounds. So next I will listen to his heart, and his heart, I will listen to the aortic valve, which is in the second intercostal space, and the right sternal border, the pulmonic, which is also in the second intercostal space, but it's in the left side, and then Erb's point is in the third intercostal space, the left side, and then the tricuspid, fifth intercostal space, and then the mitral, which is in the also in the fifth intercostal space, but it's the mid-clavicular line. Okay, and I will have to set a timer to listen to his apical pulse. All right, and his pulse was 72. And there were not any extra sounds, no murmurs. The rhythm was regular. So now I will inspect his belly, and I will listen to his bowel sounds. Do you just want to lay down, please? Make sure you can still see. Okay. So his umbilicus is inverted. His skin is warm. No lesions or anything like that. No visible peritoctalis or pulsations. And now I will oscillate on all the quadrants. So I would say his vowel sounds are normal. Normally they're less, like 5 to 30 is normal, and over 30 per minute is hyperactive. And palpating lightly in each quadrant. Do you have any pain?
No.
Okay. So in his upper right, you'll find the liver, the gallbladder, and in his upper left, you will find the stomach, the pancreas, and the spleen. In the right lower quadrant is usually your appendix, and in the left lower is most of your small intestine. So now I will take his brachial pulses. They're +2 and they're equally bilateral, and also his posterior tibial pulses, and which you lift your leg, they're back here, and then his dorsalis pedis, which is right here. At the same time, they're equally bilateral, and he does not have any edema on his feet. And